Hey there, David Chesworth coming here for another episode of Health Talk, and today we're in the Healthy Kitchen at Hilton Head Health, and we're going to be talking about continuous glucose monitors. Now, we've got the perfect person here to talk about this, our very own registered dietitian, Elizabeth Huggins. So, Elizabeth, thank you so much for joining us today. I know this has been something that you really kind of brought to the table here at Hilton Head Health. You said, hey, there's this really cool device that could be super useful for our guests here, and I know you've been implementing it, and a lot of guests have really enjoyed it. In fact, we've got a specialty week coming up in November, Diabetes Week, where we're going to really be talking a lot about this. You're going to be spotlighting it. So I figured what a perfect opportunity to talk about this and just inform our listeners and guests more about them. So I guess first, Elizabeth, first of all, what is a continuous glucose monitor and how does it work?
Okay. So a continuous glucose monitor, it is just that. It is a device that is continuously measuring blood glucose in the body. And so it's an amazing device, and it started out very much for folks that have type 1 diabetes, and it's evolved like crazy over the last 20, 24 years. So it's really interesting. As a certified diabetes educator, I started out in 1996. Our name is technically changed, so we're Certified Diabetes Care and Education Specialists.
Interesting.
And so I was working at University of Florida in 1999 when the first continuous glucose monitor came out. And so it was really cool. It was this device that you would come into the clinic and we'd get people set up on it, but they wouldn't be able to see their blood sugars. So they'd wear it kind of like a Holter monitor.
And what's a Holter monitor?
So if somebody's ever had any cardiac issues and they want to check out heart rhythms, so you go in, you get it put on, and then you leave and you take little notes about how things are going, and you come back to the clinic and they download it. So the sensor was the same setup. The person wearing it was actually blinded to the information.
I see. So only the doctor could see.
Right. So, but not in the moment.
Right.
So basically, you'd wear this device. It would be monitoring your blood sugar. You would take notes about your activity, your eating, if you had symptoms. And of course, they'd still check their blood sugar. They actually still had to calibrate it, which means they'd have to check their sugar and then tell the machine, this is what my sugar is, so that it could kind of adjust if it needed to. So flash ahead to now, and it's amazing. So we've got these devices that every 5 minutes, a person can see what their blood sugar has done in 5-minute period. So you've got this constant bit of information about blood sugars. And you might say, well, why do I need to have every 5 minutes? Well, it's not so much that it's a 5-minute period that somebody's literally going to be looking at their meter, but it gives people an amazing ability to look at patterns. Here, it's really fun to see how maybe somebody was wearing one prior to coming in and what their blood sugars look like. And then, you come to Hilton Head Health and you start changing what you're eating and you start moving a lot more. And it's just crazy to see the amazing results. Now, the original sensors, it was a lot about safety, and they still are very much about safety for folks that take insulin or medications that can lower blood sugar. So in other words, if you have a low blood sugar, that's scary and it can be life-threatening. So the high-end ones, they have all sorts of alerts that will tell you if you're going low, if you're excessively low. And the really cool thing, so just 2 days ago, Dexcom launched a new product, and it's called Estelo. And this is geared for folks that aren't on medications that would cause a severe low. So folks maybe that have type 2, maybe they're taking metformin, or maybe they're just trying to diet control. And so it has been FDA approved, and it just launched. It just hit the market, and you don't have to have a prescription. You can just buy it over the counter.
So just to clarify, for anyone who maybe is less familiar with the continuous glucose monitor, these are those things that you see people, they put in their arm. It's like a little circle. They put on patch-looking thing.
Yeah, some of our guests say the little button thing.
Little button thing. And so a lot of our listeners may have already used them before, and some of them maybe haven't. Is the over-the-counter version, does it visually look the same? Is it the same type of thing?
It looks the same. It doesn't have as many bells and whistles. One of the things that can happen with a sensor, I mean, the technology is amazing, but of course, there's still things that can occur. And so the ones that you wear, there is one that is an implantable, but the ones that you see people wearing, you can get what's called a compression low, so that, sometimes when people are sleeping, they'll get a false low, and it wakes you up, and it's kind of annoying. So for somebody that they're not taking a medication that could cause a low, this new, so it's called a Stello. This new monitor is really nice where people can gather information, but without all these potential alerts that could actually disrupt their sleep or cause a little anxiety. Oh my gosh, I went a little low last night, and maybe, they weren't technically low in a dangerous sense whatsoever. They were just on the lower end. So it's really cool to have, the products that are very specific for people that have diabetes. And I haven't mentioned this yet, but in that evolution process, people that wear insulin pumps, which we do have guests, they come here, they live very healthy lifestyles, but they also have diabetes. And so they might come wearing an insulin pump and a continuous glucose monitor. And so they're designed where they will talk to each other, and they can also regulate the insulin. So if somebody is starting to drift down low, you can have a device that talks to the insulin pump and says, hey, back off on what's called a basal rate, which is like a little trickle of insulin.
Like a complete digital pancreas.
Yeah, it's not perfect yet. I mean, that is the goal, to have like an artificial pancreas. Mm-hmm. But it's really cool to see how, it started out as, a basic product that the consumer didn't even get to see the information. Mm-hmm. And now you've got not just the, fancier versions, but you've got this new version that you can get over the counter, and you can see what's going on. You can see how taking that thermal walk impacts your blood sugar, or a beach walk in the morning, or what
really
you
test
eat.
Anything. Any activity, any food, see how it affects your... And look at the app in real time.
Yep, and look at the app in real time, which is just, it's such useful information. Mm-hmm. And it can be incredibly motivational for people to be able to feel like they have control.
So far we've been talking about this in the context of diabetes. Are there any other reasons someone might get this, any other type of demographic? So
certainly people that... maybe they have a history of gestational diabetes. They're at higher risk now of developing diabetes. Maybe somebody's been told they kind of keep fluctuating between maybe pre-diabetes. And, quite often what happens, somebody will be told, hey, your blood sugars are elevated. And they really get after lifestyle change, and it comes down, and then life occurs, and then it drifts up. And so the cool thing about these products is, and I haven't said like how long you wear it or anything, but, they started out every 3 days. Well, now, most of them are in the range of 10 to 14 day wear. So once you put it in, you're good to go. You shower, you swim. There's special things that you have to pay attention to. You can't put sunscreen or lotion near that spot because it can mess up the adhesive. But basically, you can wear this device. Okay. So back to your, who else might wear it? Well, now we have this whole group of people. What if you're an athlete and you're going out for a run and you're training hard and you want to see, well, how is the timing of my food, carbohydrate? So they're starting to, they've been doing this for a while. I shouldn't say they're starting to. A lot of products get used in advance. Mm-hmm. But now, we're hitting a new level of using a sensor. And so the FreeStyle Libre is another brand. So there's Medtronic, which was first back in 1999. And then along came Dexcom. And then came FreeStyle. And FreeStyle Libre, they just received FDA approval back in June to launch 2 new products. Mm-hmm. And one of them, like the Stello, is geared for folks that have type 2 but aren't taking insulin. And then there's going to be a new version, and so it's a FreeStyle Rio is for people with diabetes, and then there is a FreeStyle Lingo. Mm-hmm. I love all these names. That's for anybody. So if David says, hey, I want to wear this little button thing and see what my blood sugar does throughout the day, how does that affect, when I'm watching it, am I noticing my energy dips? Or, I went out for that run and I felt like I was really kind of tanking. I needed some energy, for people that are training for ultra endurance events. It's we've gone from one very specific purpose to now, it's going to launch and be for anybody that has an interest. So that really hasn't hit the market yet, but it's been FDA approved.
So soon.
Soon, yeah.
So really someone who's diabetic, you would definitely recommend has something like this to monitor. And someone who's a high-level performing endurance athlete is another example you gave. What about just for like the regular population? They don't have a chronic disease. They're not super fit. Since this is going to become over the counter, do you foresee just a lot of people walking around with these? And as a dietitian, do you recommend that?
Okay, so it's kind of uncharted territory. And the great thing is if you don't have diabetes, for the most part, if you're living a basic regular life, doing the lifestyle stuff that we teach, your blood sugar information is going to be very boring, which is great. You're cruising along, you see it go up a little. You're not going to see big ups, big downs. But it can be really fascinating. I mean, I think the curiosity factor is really interesting. And somebody might seek it out, wear it. And I mentioned, now they're up to like 15-day wear. Well, somebody might choose to wear it and then say, well, that was really interesting, but okay, not a whole lot to see here. And okay, maybe I'll wear it again sometime down the road. For somebody that's at risk of prediabetes, you could say maybe they periodically wear it just to make sure they're staying in check. So, I mean, there's a lot of different purposes, but for people that are in good health, etc., I don't foresee that somebody is just going to continually wear this thing, because if you're not learning anything new, why would you keep doing it? And they still cost money, so the original ones, very much geared for insurance coverage. I mean, that was the thing, because otherwise a month might cost, just under $400 to wear it. If you go back to kind of a benefit for folks that have diabetes who, maybe they were checking 4 times a day, 2 times a day, 10 times a day. When you think about having the freedom of not poking your finger, and a lot of times that's what people will say, oh, that thing where you don't have to check your you don't have to poke your finger, that was like crazy freedom just from the person wearing its perspective. But, back to like, I don't even have diabetes. Do I want to wear this thing? I feel like there'll be people that are really interested to see, how different foods impact them. But if they don't really see a lot of movement with their blood sugar, I don't anticipate that they're just going to keep wearing it.
There might be a short-term interest.
Yeah.
Long term.
And then, they might kind of every so often jump in, check it out again. So the really neat thing is you can use it as a tool, but you also have to know what you're doing with that tool, because from a nutrition standpoint, I could say you could eat something that was very not healthy. I mean, let's say you had pure lard and you're like, what does my sugar do? Well, let's say your sugar doesn't really do much.
Right.
You could make a conclusion, that must be a great thing to eat.
Right. It's a tool, but it's not an all-encompassing tool.
You don't want to have blinders.
Right.
So you want to apply good lifestyle principles.
So what specifically is the information you do get when you see your blood sugars, whether you're diabetic, an athlete, or anywhere, like you're wearing this and you see that certain foods or certain activities affect your blood sugar. Why is that meaningful?
Well, and this is really in the diabetes arena,
sure. So
where
specific to diabetes.
It is very important because both short-term and long-term complications. The short-term stuff is scary in the moment. If somebody has a severe low blood sugar event, they can pass out. If they go low enough, they can have seizures, coma, that's very extreme. Well, it could be more like, I don't want to get in my car and drive and not be,
because they might be
thinking clearly,
lethargic maybe, or
just, brain is not as sharp and snappy. So reaction time could be poor, or somebody can get to the point if their sugar's too low where they're not really reacting. So, in the moment, there can be very specific safety. I, in the past, have really enjoyed helping out with diabetes camp. And I remember, one night, some girl's alarm was going off, and, she's a teenager. She was sleeping hard through the alarm. It woke me up because I was, there as a counselor. And, her blood sugar was down in the 50 range, which is, that's too low.
So just for context, people who don't know what that means, what's the normal healthy range?
So if you are in the United States, Canada has a different range, but in the United States, we use milligrams per deciliter. And so if a person, for example, checked their blood glucose, which technically is a little different than using a sensor, and I'll explain that in a second.
Okay.
But I would say it's a normal blood sugar. You could say it's kind of like a passing grade in school. What's a passing grade in school?
C.
Okay.
Yeah, right?
Okay, number-wise?
Yeah, number-wise, 70%, I don't know.
70.
Yeah, okay.
Put him on the spot.
Yeah.
When you have to do that, you remember it better, though, right? When you're like, what is a passing grade in school?
It's a C is average,
So
right?
70 to 100.
Okay.
Now, technically, sometime back, I don't remember.
When you're fasted, or
it used to be a little higher, but in the early 2000s, they lowered that diagnostic criteria. So technically, it's 70 to 99.
Okay.
But close enough to get a bearing.
Also when you've had a meal? Or
Okay, no.
Okay.
So that's
specifically
really,
fasted.
Yeah, that's really important. So, you wake up in the morning, you haven't eaten overnight, you should be in that 70 to 99 range.
Okay.
If you eat a meal, and even if you don't have diabetes, it's going to go up.
Right.
Now, how high it goes depends on a lot of different things, but how much carbohydrate really can make a difference. And then the type of carbohydrate, if it's quicker to digest. Mm-hmm. So if you chugged a Coke, a soda that has regular sugar in it, you're going to see your blood sugar go up very quickly. Mm. If you sat down and you had, a garbanzo bean salad, it's still carbohydrate, not as much, and then it takes longer to digest. So you're not going to see it spike up like it would. I always kind of joke when I was wearing it several years ago, I had fun trying out different things. And as a dietitian, I like to eat healthy. I feel better. But I had fun. I had pizza and a regular soda. I had cereal, and Life cereal definitely sent my blood sugar up. Thankfully, my pancreas is quick to work, so it went up, but then it came down. So if somebody, let's say you put it on and you're like, let me see what happens, depending on what you eat, you might see it go up and come down quickly, or it might go up and linger a while. If it's a fattier meal, things that kind of take a little longer to digest.
Is one more concerning than the other?
Well, you don't want it to linger for a long time. So, back to if you're too low, definitely not good, not safe whatsoever.
Below 70.
Yes. But if somebody has high blood sugars for an extended amount of time, over the years, that causes damage. I mean, there's immediate complications to very high blood sugar. So let's say somebody's walking around with blood sugars 300, 400. And,
How common is that?
I don't know that I'd say how common. I mean, there's plenty of people that will go up that high if they don't remember to take insulin. Or, they're not monitoring their sugar, et cetera. So
I guess what I mean by
that's
that
not
is
like
if you're not diabetic, would it be normal to go after a meal?
No. So, you might expect to see somebody might even make it to 180, but basically a guideline would be 2 hours from when you start eating, you should be back down under 140.
Okay. So for someone who's not diabetic, a higher number might be in the upper 100s. Yeah. But then when you're in the diabetic zone, it's not uncommon to see in the 300 or 400s.
Right. Not that, and I mean, if somebody has good management, good control, then no, they're not going to see those kind of numbers. Mm-hmm. But diabetes, as far as type 1, it's a tough disease to control, bottom line. Yeah, so it's we have this full spectrum of,
And can you clarify the difference between type 1 and type 2 for anyone who might not be clear on that?
Okay. It's actually a really good question for clarity, because a lot of times people are confused with that. So type 1 diabetes, it is an autoimmune disease. It used to be referred to as juvenile diabetes, but putting an age like juvenile is not a good way to describe it because people can be in their 50s. It is autoimmune.
Okay.
We don't know yet. I mean, they're working on trying to identify, and there's some new drugs out there trying to identify people that are developing it and seeing if they can, slow down that immune response. But it's definitely, there's nothing somebody ate that causes it. It is immune.
The body attacks
autoimmune.
its own pancreas.
Yes. Okay. And so the cells in the pancreas, the beta cells, they're destroyed. You don't have those cells to make insulin. Now, type 2, it used to be described as like, oh, you don't make enough insulin and you don't use it well. I know you've heard the term insulin resistance. So,
or that used to be called adult onset.
Yes,
but
adults. Yeah, because, now we have kids that are developing it. So, they're very different. And, getting back to the idea of sensors, there's a lot of different moving parts and pieces of why it makes sense for one person and what blood sugar levels they might be looking at. For somebody that has type 1, and let's say they're 80 years old, the target, what a doctor might want to see is going to be different than somebody that's in their 40s, 30s, etc. So high sugars, I think a lot of people understand diabetes can be a devastating disease, can cause really bad things to happen if the numbers are not closer to a normal range.
They're not managed.
Right. So it is very challenging, and folks have a lot of decisions. There's all day long, there's things that affect blood sugar, but you've heard of an A1C before, right? And you've heard of blood sugar.
Yes.
Okay. So
for anyone who doesn't know what an A1C is, can you explain that?
So when you check your blood sugar, that's that moment in time, right? The A1C, we've referred to it as like a 3-month test. And people always say, how can it be 3 months? They check it right then. How can you tell? Well, the technical name, it's a glycated hemoglobin A1C. So it's basically looking at your red blood cells to see how much sugar has permanently binded. Hard for me to say there.
Yeah.
It has attached to the cell. And once it attaches, it's there for the lifespan of that red blood cell. So let's say that you've had periods, weeks, where your blood sugar is much higher. Or maybe there's certain times where it's down in a normal range, but after meals, it goes up and it lingers for a long time. The more exposure during that 3-month period, the higher the A1C will be. So it's looking at red blood cells. And
in addition to blood sugar, it's also capturing the sugar attached to the red blood cell.
Right. It's looking specifically in that. And then it's been correlated to what that, equals out to as far as an average sugar. So, you could say, if we wanted to know what this whole room looked like, and I said, you only get to look, right here, for example, you have no idea what's going on in the room. That would be the blood sugar. Just right there in the moment.
No context, just a snapshot.
The A1C is kind of like stand back, look at the big picture, but you don't get all the details. Maybe it's not that it's a blur, but it's a little bit of a quick...
Bigger picture, higher level.
The difference with a continuous glucose monitor is now you're opening up and being able to see everything, blow by blow detail. So, it... in the world,
it's a lot of snapshots.
Yeah, it is allowing somebody to really put everything, all the dots together. Yes, and make decisions that help.
So does the continuous glucose monitor also do A1C?
So it doesn't do A1C necessarily, but it the thing about all of these now is they have great statistical information. And so you can look at, your average blood sugar, you can look at the deviation. It's really pretty amazing, the information that you get. So bottom line is that there's a big emphasis for time in range, where you can look and see, overall, how much variation do I have, but how much time overall am I in a normal range or close to normal range.
Because the more you're in the normal range, the better it's being managed.
Right. And so for somebody that doesn't have diabetes, is curious about these, you can say you're still getting information like, okay, what are my deviations?
Am I living a damaging lifestyle?
Yes. What are my deviations? Yeah. And, then big picture overall, am I really pretty much spending all my time in range? And maybe so I did wear it this year. And it was the tail end, was on Thanksgiving Day. And it was interesting because my blood sugars stay very normal. But for Thanksgiving, there was kind of the grazing in the afternoon, and it stayed a little higher than it usually does, which, I kept eating little, things coming in. So it does give you a tool, because what if that was your typical way of eating and you're at risk and, that, is pushing you more towards having issues.
So as a dietitian and diabetes educator, have you seen firsthand that the same foods could affect two different people differently?
Oh, that's
even
a good question. Yes.
Like the health foods that we would talk about here, fruits, vegetables. Like one person's fine with it goes up and down quickly, another person's that same food.
So definitely, depending on how well somebody makes insulin, is going to determine what their blood sugar does. But you bring up a really fascinating question that even within an individual, you don't get exactly the same results.
From the same food item.
Yeah.
The same
now,
individual.
If blood sugar, like I said, is not an issue in a person, you're probably not going to see a lot of variation. But with people that have diabetes, even eating the same food doesn't initially exactly produce the same result. So the thing that I like, you're looking at big picture patterns and identifying if there's something that really rocks the boat, where I was talking to one of our guests recently, and there was a specific item that this person was eating that every time they had it, it popped them up, like every time. And I don't know, no, this was once they went back home. Oh, okay. And so, that was one of those where take-home message was, wow, that really does impact me. Nothing else really sends my blood sugar up very high, but that particular item, which was more of, like a desserty bread type of thing, it would send her over 200. So that is a little teeny bit of information that you could say, okay, that's worth looking at.
Interesting.
Now, the thermal walks that we recommend here, that might be the type of thing where if somebody eats a meal and they look at what their blood sugar does, they go sit on the couch, different response than if they eat that meal and then they go out for a stroll. A 5-minute walk isn't going to do much, but if somebody is saying, no, I'm going to go for, 15, 20 minutes, not a super fast pace or anything. So, there's definitely teachable moments, things that people can learn. We know from research for people who have diabetes that are given a continuous glucose monitor, and they can look at their information and they don't get a lot of, education or lifestyle. Just simply having that, it's like having a speedometer, where do I need to let off the gas, put on the brake, with lifestyle behavior.
Right. Feedback.
Yeah, so it's, in the world of, I guess, biosensor, feedback, it is a great tool. Well, you can tell I'm excited about it.
I can tell. Well,
I want to go back to one more thing.
Well, hold on. Okay. Before we leave that point, because you said a couple of things that got me thinking. So one is, for someone who's just a health enthusiast who might just be very curious about this.
Are you talking about yourself?
It could be someone like me. Yeah. There could potentially be some education, but also some incomplete context if you only use it briefly. Like you said, within the same person, they could have the same food item and it affects them differently at different times. So if I were wearing it for just a couple days and I was curious, what does a banana do to me? And it's seemingly not great in that day, and I just assume that bananas are always bad because of the context.
Right.
I could see that as a not great thing because I could maybe there's a lot of benefit to having a banana, but I'm not going to have it anymore. It seems like it would be wise to do it long term to really get better information. Am I understanding that correctly?
Yes, in a sense. Like when you put them on, you're going to have at least 10 to 14 to now 15 days of wearing it.
Sure.
So that's where you'd really want to, if you're planning on wearing it for a short time period, you could really try to log what you're doing and then, go back at the end of wearing it and look for common themes. It might be that I had the banana, but I also had cereal and orange juice.
Right.
And it's not the banana in itself, because there is how much total carbohydrate, what was in the meal, etc. What I was going to say earlier is the thing that I think I like so much about sensors, and this is probably still more for folks that have diabetes, because like I said, for somebody that doesn't have diabetes, your sensor tracings might just look pretty boring. Where you're not seeing a lot of variation because you don't have diabetes. But as a dietitian, how do I know? I mean, I can give somebody a guideline saying this would be a reasonable amount of carbohydrate to shoot for, choose good quality things. But then when somebody's actually wearing it and being able to say, for me, I can see based on the medications I'm taking, et cetera, hey, this is really working. Or maybe I'm doing my best. I can't go any lower with carbs. I'm already very low and my numbers are still high. I need to get in touch with my doctor. So it isn't just simply follow this because I said so. The person gets that unique input,
individualized,
that biofeedback, which is cool.
That is cool.
But I feel like, if somebody, like anything, if a little bit of knowledge can kind of be dangerous if you make improper conclusions.
Right, because I could see someone who's like preventative minded, assuming that same food item will always affect them the same way if they had a bad moment. Like maybe they didn't think about the fact that they had it with these other things, or they didn't get as good sleep or the night before or whatever. I don't know what else could influence it.
I mean, there's tons of different things that influence it. With diabetes, it's much more amplified.
Sure.
So, women, it could be, are they on their period? Are they starting their period? I mean, hormonal stuff, because, insulin is a hormone. Diabetes is all about regulating a hormone or hormones.
I guess it's like any metric. It is better if you can look at a big picture and use that as a learning tool as opposed to isolating a snap, even getting on a scale one time.
Right.
After
Right.
Yeah.
You could drink a bunch of water and get on the scale and say, oh my gosh.
Yeah, right, exactly.
Yeah. Or, I'm dehydrated and I lost weight. This is great. Obviously it's not.
Right.
So, you have to make sure you understand it. And if you don't, if you're wearing this and you don't totally understand, and I guess that's why I find it so interesting and exciting, is because if somebody is wearing it and then they have great questions, it gives me an opportunity to help them understand. And, I love teaching people. Yeah. And so that becomes really fun to be able to do that.
So we've got Diabetes Week coming up here.
Yes.
In November.
Yes.
2024. And how do you see yourself, or how do you see the Diabetes Week implementing these?
So in addition to what we've done with, lots of lectures and talking about blood sugar, what I would love is for people to have the opportunity to, of course, whether they're already wearing one and, continue to wear it here, or if they've never worn one, come here with an opportunity to wear it. If they're only here for a week, it almost gives them an opportunity to straddle the real world, not just here where
start wearing it while you're here and continue wearing it when you go home.
And so when people here have done that, it's very fascinating. And I always tell people, I want them to try some things they usually do, so that they can see a contrast. Because if they come here and their blood sugars look great, what could you conclude? Like maybe, oh, good, I don't really have to worry about this. And then you're not wearing it and you don't realize that in your everyday life, maybe there are some things that really actually are driving blood sugar up.
Right.
So, I mean, I encourage people to kind of rock the boat a little bit just to see, the contrast. And I will say, typically what we see is levels are here when they're physically here. And when they go home, they tend to creep up a little, especially after eating, those post-meal readings. can get more interesting. And, that's valuable information as long as someone is doing something with that. Because sometimes people have a tendency to say, well, I know it's going to be high, so I don't want to look.
Yeah.
So, it's all about the individual. Somebody that maybe has a lot of anxiety and they don't even have diabetes, maybe something like this wouldn't be good, because what if, the sensor shows that they were a couple points under that 70 and maybe they weren't technically low. The sensor has a little bit of, especially the first day, it's less accurate. So if somebody were living, holding their breath, looking at every little reading, that could cause somebody to be more anxious.
Unnecessary.
So, it's a cool product, but it has to be, used in a wise fashion.
Probably
for the right
alongside
person.
Talking with a professional is the best way.
Yeah.
Even though there's going to be over the counter, having some sort of knowledge or someone with knowledge guiding you.
Yep.
Is probably the best way to use it. So I have one more question for you, and it goes back to something you said probably earlier in the podcast episode, which is you mentioned that when blood sugar spikes and stays up, that's when the damage happens. What specifically does blood sugar do to damage the body?
Okay. So if you go back to the A1C, for example, we know that we have sugar attaching to the red blood cell. Well, in a somewhat non-invasive way, we can take a sample of blood and see that going on. But if you think about it, you've got these little red blood cells floating down the blood vessel. You also have the blood vessel and the lining.
Yeah.
So do you think sugar might possibly stick to that?
Sure.
Of course. And so then you say, where do you have blood in your body?
Everywhere.
So basically the A1C is a way to measure the risk. And the longer somebody stays high, the greater the damage that can occur. Our bodies are pretty tough. There's people that were diagnosed and their sugar was maybe 800.
And the sugar can damage the lining of the blood vessel.
That's occurring over time.
Okay.
Wherever blood is.
So similar to plaque buildup, but it's sugar buildup.
Yeah. So, that is affecting the tissue. There's a big emphasis for, blood sugar control for all these different complications. And I feel like now people are a lot more aware of things like dementia, and not wanting to go there because maybe they've seen a loved one. Well, when you think about it, high sugar affects cognition. So, once again, an application, what if somebody has a high risk of Alzheimer's in their family and they want to wear a sensor just to see like, hey, I don't want to be having a problem with this. So, it's from a blood vessel standpoint, you've got damage. For folks that have diabetes, once again, you also have the nerves that can be damaged. So if sugar, passively goes in those nerves. And
that's where the neuropathy can come in.
Yeah, the neuropathy, the eye damage, the kidney damage, but it's all a byproduct of high sugar. It's just too high for the tissue.
I've heard going around that Alzheimer's might be considered type 3 diabetes. Is that what's that all about?
So, basically, like any health issue, there's more than one thing, but certainly high blood sugar is
a risk factor.
It's definitely a risk factor.
Okay.
You mentioned plaque, of course, but then like we discussed here, how is your sleep, your fitness, are you eating good foods, not just foods that are devoid of something like, it doesn't have too much salt in it, but it's a pretzel. It's like you're not getting all those good nutrients that your body needs. So it's, yes, there's definitely a connection there. So, like I said, the sensor, there's lots of different applications where somebody might want to take a peek, but they're not going to continue to check on a long-term basis. Whereas somebody that has type 1, that if that's controlling their pump and helping them really have great blood sugar readings, then, that's a amazing tool to have.
Yeah, for sure. Well, this has been super fascinating. There's definitely been, a lot of this I knew about and some things I didn't know, and it was really cool to learn from you about this. Elizabeth, do you have any final words for our listeners today as it relates to continuous glucose monitors or anything we talked about today?
Oh, you mentioned the diabetes week, and so,
Yes.
we'd love to have people come to that for sure. It's a great opportunity to, take some time out, take care of yourself, really focus in on that, especially before the holidays kick in and things get crazy. But I guess, the thing in general is, just trying to live that healthy lifestyle, like we promote here.
Yeah.
Super important. So, this is an area, obviously, I get really excited about.
I see that.
So anyway, I love to share my knowledge. We hope to see you guys if it makes sense for you.
Yeah. See you at Diabetes Week. Yeah. So, well, Elizabeth, thank you so much for joining Health Talk today. And those of you watching at home, thank you so much for tuning in and listening. I hope you got a lot of value out of this and learn some things about continuous glucose monitors and diabetes, and also come join us for the Diabetes Week. And as always, be sure to ask us questions. Make comments below. What else would you like to learn about from Health Talk? Who else would you like to hear us talk to? At the end of the day, Health Talk is completely for you, so we hope you get the value you're looking for out of it. So thank you for joining us. We'll see you next time.